as well. I'm really excited for today's alumni guest speaker. So this is the second in our series. But before we get into that, do have a couple of quick announcements, and also want to do a little round of introductions so everybody knows who's here. So did everyone grab these handouts? Okay. So one of them is just a handout for today, which includes our guest speaker's bio and some of the upcoming events for the Allied Health Academy. The other one is the evaluation. So remember, before you leave, if you don't stay, especially if you don't stay until the end, please remember to fill that out and leave it up here in the front. So on that handout, you can see that we have a few things coming up. So next week we have a Taste of Grad School session. Did anyone attend the first Taste of Grad School? I know a couple of you did, yeah. So with Taste of Grad School, what we do is we give a glimpse of what a grad school class might be like. So earlier this month, we had Dr. Jeff Gurley, also of Western University, and he gave an example of like what those classes would be like. So they were doing like tests of like fitness that their seniors do, and it was really cool. Well, I think it was cool. Yeah, and so we have another one of those coming up next week, which is with Dr. Olga Mejia, and she's from Cal State Fullerton Counseling. So whether or not you're interested in counseling, I would suggest that you come out. She's going to be going over mindfulness, but from an academic perspective, a research perspective. How does mindfulness help grad students in the helping careers, which all of you hope to be in the future, I think. So come out to that if you can. And then for all of our new members, we have a mentoring retreat next Friday. So that's 1 to 5. Come out to as much of it as you can. I think from our returning members, did you go to it?
Retreat last year?
Yeah, retreat last year.
I'm just sure.
Oh, so you had to bring a part of your food?
Yes.
Didn't you bring food?
No,
you were talking about the bakery.
I talked about, my grandparents' bakery.
Yeah. So it's a cool opportunity to learn more about folks in the academy, your cohort, and all of that. So please come if you can make it. And then we have a couple of workshops the week after that. One is about the Sally Casanova opportunity and McNair's, which are other programs like the Allied Health Academy that can prepare you for graduate school. And then we have a grad student panel coming up. So someone from, also from Western coming, someone from the MSW program here at Cal State Fullerton, the counseling program here at Cal State Fullerton, and the MPH here at Cal State Fullerton. And then another reiteration of that Sally Casanova McNair's workshop. And then our final alumni guest speaker for this semester will be Dr. Rogelio Serrano, who graduated from the counseling department here. He's going to be talking, well, I don't know specifically what he's going to be talking about, but he does work in the prison system and does a lot of work with Latinos and deals with like masculinity, violence prevention, and things like that. So I love all of our guest speakers, so I think you should try to come out to that if you can. I know it's the week right before break starts, but try to prioritize that. And then also a plug, Western University's next preview day is actually Saturday, November 19th. So if you haven't made it out to one of those, I strongly recommend that you do that. Okay, so that is your handout, the evals. So we'll do a quick icebreaker, grab some food, and then we'll get right into the presentation. And then after the presentation, there will be time for Q&A. So feel free to jot down some questions as you're kind of like hearing him talk. Those of you who took our informational interviewing workshop, think of those questions. And then we'll take a group photo at the end, and then we'll close out. So icebreaker for today, and I will go last because I don't know what my answer is. Because it's Halloween weekend, what are you going to dress up as, or what has been like one of your favorite Halloween costumes if you've had one? So start this way, we'll go that way, come back on here.
All right.
Oh, sorry, and I'll also introduce your name and the career of interest.
Okay. My name is David Ruiz. I'm interested in PT. What else can you say? Our Halloween costume?
Yeah. If you're planning to dress up,
Yeah.
or if you're not like a favorite costume that you've seen or that you've done.
I've seen some pretty bad costumes, but there's some of them on appropriate. But I think I saw a Donald Trump one recently that was pretty hilarious. Yeah.
Wow.
Yeah. But I'm not dressing up. I'll probably be working. Fortunately.
They don't dress up at your house?
No. Corporations won't let you because it can be offensive and stuff like that. Yeah.
Cool, thank you.
Mm-hmm.
I'm Kaylin. I'm interested in becoming a physical therapist, and I'm going to be the dog filter.
Oh,
On Snapchat.
oh, that's so
Yeah.
clever.
So I
Cool.
can just dress normal with that.
Did you print out like?
Huh?
Did you
No,
print-
I bought it off Amazon.
Oh.
My name is Marina. I'm interested in speech therapy. I think I'm going to be a deer, which is also Snapchat. But I'm not sure yet. We'll go around this way.
My name is Cynthia. I'm interested as well in PT. I don't think I'm going to dress up this year, but last year I was Violet from the Cardinals.
My name is Maria, and I have an interest in physical therapy. I probably won't dress up this year because I have class and I'll get out too late. But my favorite costume that I remember was a Power Rangers, like way back in the day. Yeah.
They're making a comeback. They're in another movie. Can you guys sign in and grab some pen?
My name is Steve. I'm interested in PA for public health. I won't dress up this year, but I saw on Facebook this video of this little kid dressed up in a stick figure costume. It's really cute and it lights up.
Oh.
Hi, my name is Davina. I'm interested in public health. I've never really dressed up for Halloween, but I'm going out this weekend.
You're going down as Venus.
Yeah.
That's cool. Alright.
I'm Chris. I'm interested in also PT, especially the DPT problem offered by Western University.
Like, yeah.
I also, I've never done Halloween, but I like to admire costumes.
Any pretty cool that you see?
Mostly superheroes. Yeah, I don't like the scary stuff.
Yeah.
My name is Mark. I'm interested in the study program, and with integrated health and costume, I had to narrow it down to understand that well.
You handmade it?
Yeah,
Wow.
that's pretty cool.
That's cool. So introduce yourself, your career interests, and if you're dressing up on Monday or over this weekend, what are you going to be? Or if you're not, like a favorite costume that you've either done in the past or that you've seen.
Okay, my name is Sam Clark. Career interest is PTRT. I'm still looking at other health care settings, but those are the two main ones. I'm not sure if it's Halloween, but I remember my favorite costume was 6 years old when I dressed as a balloon. I really like that.
Sure.
Hi, my name is Sue. My major is economics, and I'm interested in work and travel. And I'm sorry, there's no special idea about Halloween costume because in this year, it's first time to experience Halloween Day. But I'm from Korea. That's thank you.
Hi, I'm Stacey. I don't know what the question.
Your name, your career interests, and if you're dressing up on Monday or over this weekend, what are you going to be for Halloween? Or if not, like a cool costume that you've either done in the past or have seen.
Okay, so I'm Stacey. The career choice I'm going for is physical therapy. And for Halloween, I'm probably going to dress up as a goddess.
What was that like?
Shows like that, yes, last year.
Okay.
My name is Darius. major. As they're going for PTOT, so exciting. And like that's Halloween costume or
what you're planning to be or something that you've seen that's cool.
plan to be a literally sexy guy.
Are you dressing up for that or?
I'm already ready.
We'll go around this way. Mike.
Hi, Mike, and just interested to learn more about the program at Western. Adjunct faculty member here. For Halloween, I don't have a plan yet, but I do like the political, like, whenever people dress up as political people, it's always funny. It's all like Hillary Clinton or something. Oh, yeah. I wouldn't dress up as Hillary, but just to see it.
Well, I'm John. I'm a graduate student here and a graduate assistant. I'm doing public health, and I am not dressing up this year, but last year I was a Indian.
What kind of
Native American.
We'll have a talk about cultural appropriation later.
My name is Grant. I am not very clever or artistic, so I don't really have any good Halloween costumes. But the best one that I've seen is on YouTube. There's a clip of these, what are they? The small little, they're pincer dogs. Is that what they're called? The small little black dogs that run around. They dress them up as minions, and then the dogs are running around. It looks just like the real deal. So it's cool.
I have no idea what I'm going to do on Monday. I'm actually going to a conference. So for anyone interested in public health, there's a national conference for the American Public Association, and that'll be in Denver. And so I don't really know if I'm gonna dress up at all for that. But last year what I did, I also went to that conference, and I just wore super easy, just buy it up to Target, and it's really comfortable too. So yes, Anna, just in time. Can you introduce yourself and say what your career interest is, as well as if you're planning to dress up on Monday or over the weekend for Halloween, what are you gonna wear? Or if you're not dressing up, full costume that you see.
Okay, so hi, my name is Anna Lee, and I'm a health science major. I'm planning to be like in public health administrations. For Halloween, I want to be a vampire.
Thank you. All right. So thank you all for sharing. Now we know who's in the room. If somebody said something that was kind of cool to you or sounded cool to you, ask them more about it in a bit. So what we have right now, so everyone can go ahead and get lunch. I do want to let you know what it is. So these are banh mi sandwiches, which are Vietnamese. Inside, there are jalapenos. If you don't do spicy, take them out. So we have 3 different kinds. The first tray is chicken. The second tray is either pork or vegetarian ham. So the vegetarian ham is just one colored looking meat. The pork one is 2 different kinds. So that's how you can tell. And the vegetarian ham is vegetarian. Okay, cool. So go ahead and grab some food, and then we will go into our introduction. Grant, what would you like?
After that. Yeah, cool.
Hello, good to see you. Oh my god! That's so cool. Yeah, I think that's so cool. Still seeing dog costumes. There are enough sandwiches for folks to get to, so after you've gotten one, feel free to go back and grab another one. There are jalapenos in there, so just open it up, take them out. I think there might be a couple of cookies left from Can You Steal One earlier today, so if you want a cookie, go grab it. Yeah, so it should be clear because it should only be one color meat if it's a veggie ham. Oh, maybe they gave more chicken. Oh, I don't know. This one should be pork or chicken. And then give them extra. Yeah. Okay, so everyone got their food? So now it is my pleasure to introduce our guest speaker for today. So what we're trying to do through the Alumni Guest Speaker Series is provide an example of after you go through the graduate degree, what kinds of work can you actually be doing once you're in the field. And so Dr. Grant Hirayama graduated from Western University in 2013, and so he's been practicing for a few years. He also teaches at Western University, so he teaches the first year. So if you were to start there next year or in a couple of years, he might be teaching you. What else? So he currently is a physical therapist at Casa Comida Hospital and Centers for Healthcare, which is in Pomona. And he got his bachelor's from UCI. Any fun facts?
I have one. I'll show you.
Okay. All right. So take it away.
Thank you, thank you. How's everybody doing? Good? Nice. So, I've been talking to John, and he told me you guys are about 10 weeks into your semester. So I would presume what, right in the middle of midterms? So that being said, thank you for taking some time out of your busy schedules just to hang out with me. Hopefully you get something from this lecture. And if at any point you need me to stop and answer a question, go for it, okay? Thank you, Aaron, for the introduction. Hopefully the thought of me teaching you first year doesn't sway your vote to go away from Western. I promise there's a lot of good people there. Go on. So, as I'm going to begin my talk here today, I've got a couple goals for us. One, I want to kind of introduce myself, let you know who I am. And two, I want to talk about the field of PT and kind of where practice is going. Okay. Three, I want to talk about kind of what it takes to get into PT school, kind of what we're looking for. And four, I'm going to talk to you about how I got into PT. Okay, because my story is a little bit less quote unquote conventional. All right. So as I introduced myself, I thought I don't just want to put a whole bunch of words up on the slide and people fall asleep. So I wanted to give you everything at once. Okay.
Wow.
In a nutshell, if you can see, hopefully, this is me. Okay. And I'll kind of walk through the pictures real quick as to why they're significant. In no special order or anything like that. But if you look at the picture all the way up into the left-hand corner, I labeled it San Antonio Regional Hospital. That there is oh, great, thank you. Right, this one here, that's the hospital at which I work at, and as a per diem staff therapist where I do acute care. So for individuals who come into perhaps the emergency room and they get admitted to stay in the hospital, I'll go and work in that specific setting. In the bottom here, in my spare time, whatever spare time that I do have, I become a huge fan of mixed martial arts. I love jiu-jitsu, and I've tried that myself, and that's fun. Although I'm terribly afraid of getting hurt. So if I get hurt, I can't work. So I need to be able to work. Let's see here. This is my buddy in the back there. His name's Bandit. Okay, he keeps me sane most of the time. Sometimes I like to try to cook and be fancy, and when I say sometimes, I mean once in a couple months. The kitchen gets destroyed, and it doesn't really ever come out to be that tasty. Okay, huge Laker fan. Huge Laker fan. Okay. Absolutely. What a way to start off the season, right? I went to UC Irvine, my undergraduate degree. This here is a picture of a guy fishing. That's not me. I like to fish, just don't really ever have any time to fish. Born and raised in Northridge, California, so about 20 minutes or so north and west of Burbank. And this is my first class I ever taught, and they'll be graduating. They're the third year, and they'll be graduating next year in May. So exciting times, kind of bittersweet. So if you saw Callie was one of my first few students, and she's finally getting close to leaving the institution. If I can change it, I'll hold it for a few more years. So a little bit more about myself. This is a picture of my family and I. We're at Mammoth. This is, I'm not good with names. I think it's called Rainbow Falls. I don't recall. Does anybody know? That was called? Okay. Rainbow Falls. Okay. It was a long walk in. Not very into heights, but it was fun at the very end. We got to sit down like this. Okay. Fourth generation Japanese American. Okay. Mom and dad. My father is an engineer, and my mom's a teacher. All throughout my life, she was pushing me to go into teaching. You gotta go to teaching. You gotta go to teaching. And I fought her to the end. I was like, no way. No, I'm not gonna be a teacher. Not gonna be a teacher. Little did I know, mom knew the whole time. To my left, to your right, and my left in the photo. That is my sister. She's a few years younger than me, and she is a CPA, public accountant. Growing up, I like to think that I had a traditional childhood, although I don't have anybody else to really compare with. Parents went to work all throughout the day. Went to either daycare, school, whichever, or depending on that phase of life, and came home and we did the family thing, had dinner together, and then we took care of whatever it was that we needed to do. But there's a twist, and as I kind of talk to you about how I got into PT, you will understand what I mean by that. So just a little bit about my professional background here. In terms of my training and education, currently I am the orthopedic resident over at Casa Colina. So I'm a full-fledged PT. I'm just getting a little bit of post-professional training specialized in orthopedics. Okay. First 2 years out of school, I was doing acute care at the hospital, and I wanted to kind of mix things up a little bit. I ventured into outpatient orthopedics. Didn't feel great about my skills. I thought I could be better for not only myself, but most importantly my patients. And so I decided to apply for residency, and I started that in March of this year. So that should be coming to an end in a few months. I got my doctorate from Western University over in Pomona. And based on what I've heard from you guys, for the most part, this should be an easy room. Most of you guys, hopefully I'll see you sooner than later. I got my undergraduate degree from UC Irvine. It's a bachelor's in social ecology. And if you don't know what that is, it's a transdisciplinary approach. And it kind of entails a whole bunch of different majors. Okay, public health wasn't a major there when I was in school. Toward my exit, they finally established the public health major, which I wish it could have been a little bit more sooner. In which case, in my time there, I was studying I was studying psychology and social behavior. I was studying criminology, law and society, and environmental policy. Okay. So, in your healthcare training, or when you guys get to that point in your careers, most programs, specifically or especially PT, you have to go into clinic and get some on-site training. Okay, and this is the list of kind of the things that I've done. As a student, I worked at San Antonio Regional Hospital in acute care. Sorry, guys. In acute care, and when I graduated, I eventually got a job there. The body center, that's Dr. Jeff Fairley's clinic. So I did a rotation there. So I was one of his past students, and that's outpatient orthopedics. I worked at Kaiser Fontana in the outpatient department, and I also did pediatrics. Pediatrics was super fun, very exciting and interesting. I just didn't like seeing kids cry. So I was like, oh, this is probably not my specialty here, okay? In terms of work experience, again, I'm the resident over at Casa Colina. I also do some acute care at San Antonio Regional Medical Center. And in my spare time, I teach at Western University. And then on campus at Western, we have a diabetes institute where we treat specifically patients with diabetes. We teach them how to care for their feet, remain active, how to move. Okay. In terms of my research aspirations, I have a lot of questions. I like to know why things happen. This is one of the studies that I did as a student, and we finally got it published after graduation. And what we did is we looked at kinesio tape, and the effects of kinesio tape on speed, power, and how that person, that individual, thought that they performed with the specific activities that we had them do. So what kind of generated this was, we've all seen the Olympics, right? Or any kind of major sporting activity, and they're all covered with tape. And I was wondering, what's so great about that tape? It looks cool, but does it really do anything? And so what we did is we ended up taping up these basketball players' calves, the gastroc soleus, and we had them first jump as high as they could. And then we taped them up, we had them do it again, okay? And then we had them run about a 20-meter sprint with and without tape, and then we could compare the results. After everything was said and done, we had them answer a questionnaire or a survey, and we asked them, did you think that the tape helped you? Would you wear it again? Okay. And interestingly, in terms of the data analysis, there was no benefit that we found, no statistically significant benefit in terms of athletic performance, but the participants thought it helped them. And they opted, most, I believe the majority of them said they would wear it again. So interesting. And who knows, in terms of a high level, my theory, my thought is in terms of a high level athletic competition, perhaps just thinking and feeling like you're going to do better, perhaps that might be just enough to win. That article, or excuse me, that journal article eventually presented at a conference, the California chapter state conference, where we presented our poster and our findings. Here's some additional research that I'm involved in that we are currently doing. Some is relevant to education in terms of novel strategies. So for instance, what is it called? Let's see here. The third one down, an innovative learning activity. What myself and the anatomy professor are doing is we're taking our students and we're having them tape up the musculature. So we'll use a dynamic piece of tape and we'll have them tape from, say for instance, an origin of a muscle to the insertion of a muscle. And what we'll do is after it's taped, we'll have them move. And as the tape kind of shortens, it'll get all wrinkly. And that more or less simulates how the muscle's shortening. As we elongate the muscle, the tape becomes taut, okay? And so we've used this to kind of implement and help our students visualize motion, movement, muscles contracting, muscles lengthening. And we're just seeing, essentially, we're kind of investigating what are the benefits, does this help the students learn their kinesiology and anatomy at a higher level. I've been involved in some research regarding mentorship or becoming a faculty member. And some of my aspirations for the future, kinesio tape is always on the table, but as of late, you guys have seen in these last Olympics, the new thing is cupping, right? I'm not doing any cupping, but kind of along those lines, I'm looking into what are the effects of instrument-assisted soft tissue. So if you've ever been to therapy, sometimes what you'll see is the therapist kind of pushing on their patients, working on the musculature, kind of freeing up any kind of soft tissue that needs to be freed up. And what's new is these types of things, which are instruments that we use to save our hands, make our treatment a little bit less tedious on our bodies and more effective for, or in theory, more effective for our patients. So this is an example of the tools that we use. So I brought them so you guys can kind of check them out. Okay. How about we start this one in the back? And I basically want to see, are these beneficial? what effects do they actually have with regard to soft tissue and movement in general. And so those are kind of projects that I have for the future. In terms of prevalence, in our current practice, I think it's something that's growing, but still very underused. Okay? In terms of some of the additional things that I've taken, continuing education, believe it or not, once you get out of school, you kind of miss it. And so the thing that's nice is once you get out and you're practicing, you get to go back and you choose courses that you actually are interested in, and you can really hone in on the topics that you find interesting. So what exactly is PT? I pose this question because this is in line with where current practice is going, okay? Now if I were to ask Kaylin, right? If I ask Kaylin, you're gonna go see your cardiologist. What is that cardiologist treating? Your heart, right? And then if I say, David, you're going to see your nephrologist, or your endocrinologist, what do they treat?
Kidney?
Right, exactly. All right, now here's the big, you're going to see your PT, your physical therapist. Sorry, forget your name. Marina. What are they treating you for? True, absolutely correct. In some sense, absolutely. Some muscles, sure. Any other ideas? And that is our current as a practice, as a specialty. That's our challenge right now. We're getting the public and PTs in general for us to all understand what it is that PT does. Okay? So because I have you, you will all know, right? We are the specialists in movements, okay? And what we do is we diagnose and work with patients of all different ages, with varying types of medical pathologies, and we focus on teaching people how to move, and teaching people how to move better, okay? Restoring the movement system, essentially. Everything that we do in life, whether you're sitting there eating, walking to class, all movement, right? If you can't move, right, more or less you can't accomplish your daily activities, more or less nothing happens, okay? So movement is terribly something that's overlooked, and something that as practice, as a PT, we find extremely important. Here's some additional facts about physical therapy. Okay, we diagnose and manage movement dysfunction and enhance physical and functional abilities. Okay? In conjunction with optimizing a person's ability to move, we promote wellness and fitness. Okay? And in doing so, as people move better, generally, quality of life improves. Think about yourselves. I'm sure you all exercise, go to the gym, right? And if you're regular about it, you feel pretty good, right? And then maybe finals hits or midterms hit, and you're like, man, I haven't been to the gym in about a week. I feel horrible, right? Difference, what's that X factor? Just plain simple movement, right? Okay, so in doing so, PTs, I like this picture because we wear a lot of hats, okay? PTs, you can specialize in all sorts of different specialty practices. And for myself, that's something that I think has kept me interested, kept me motivated. Part of my week, I teach. Part of my week, I go and work with acute care patients. So maybe patients who haven't been out of bed in a week. And then the last part of my week, I'm working with patients who are perhaps dealing with troubles lifting their arm up until it happened, or even that athlete that's trying to get back from an ACL rupture. Okay? Some additional kind of specialties that you as a physical therapist can go into. It involves perhaps neurologic population in a rehab setting, so teaching a person how to walk again. In a school setting, working with children. And then in general, just general wellness, okay, health promotion. In terms of what we treat, the list, this is just a small list, but as you can see, the variety in terms of pathologies is immense. Anything from arthritis all the way to your TBI. And what's nice about physical therapy is that we treat everything, whether it be the great toe or big toe, all the way to cervical spine. Okay. And one of my colleagues from school and at Western, she even treats specifically women's and men's health. So going into the pelvic floor and treating that specific musculature. These are some of the core values of the PT. In which case, should you elect to pursue a career in physical therapy, this is kind of our main sets of what we try to resemble at all times. Okay? If you recall the image on your right, that's Dr. Jeff Therapy in his practice. And then the image on the left is a picture of my, let's see, this is my acute care class. So this was the first day of their second semester. And basically they got to class and had the doors all locked. They didn't know what was going on. So please excuse their casual loud attire. But what we did was we created a simulation where in there, in the room, we had a patient waiting. They were in the hospital bed. They had lines, tubes, and drains hooked up to them. There was a live EKG monitor, which one of my other faculty members was managing in terms of heart rate, blood pressure, respiratory rate. Okay? And basically the students came in, and I think that was the most quiet I've ever heard them enter the room. They didn't really know what was going on. I didn't get a picture of it, but on the screens there, we actually have an all-joint Facebook. Now they're already part of Facebook, but a group that I created. And what I wanted to do was I selected 3 to come up and basically treat this patient, evaluate and treat them. And should they run into any kind of roadblocks, Facebook was there. Their classmates were there to give them suggestions as to what do they think they should do. And it turned out to be a great experience. The 3 students up in front were sweating terribly. But they ended up doing wonderful. And it really was a great learning opportunity, I think, for all parties involved. So should I end up seeing you at Western, please keep my secret. Okay. All right, some things to kind of further persuade you towards a career in PT in terms of overall job satisfaction. These are some quotes that I'll read for you. CNNmoney.com gave physical therapists a grade of A for personal satisfaction as a quality of life indicator in 2012. Forbes ranked us as one of the 10 happiest jobs in 2011. And physical therapists have one of the highest job satisfaction levels, 78% very satisfied with the chosen career, and then that's the site in terms of who ran that site. Okay. In terms of job outlook, it's terribly good for us as PTs. As the baby boomers kind of get up there in age, right? They're coming towards us, and it's going to be our job to take care of them. And again, just maintain and restore any kind of movement dysfunction and teach them how to move. Okay? Again, the numbers are what they are. And all I can say is that our waiting list at CASA is huge. So there's a big demand need. So if you are interested in PT, the job outlook looks good. Current grads have no problem getting a job, and I don't see that changing anytime soon. Okay, benefits of PT. Okay, there are a lot. And what I did here was I really want to show you that PT is so broad in terms of what you can do. Okay, so as you can see on the picture to your right, on the very far right, that's going to be kind of your hospital setting, your rehab setting, where they're more or less getting this person up. That person is in a employer lift, so basically they are strapped into a harness that's supporting their body weight, and they're more or less, the 2 PTs there are helping that person begin walking. And then the picture on the left is going to be more of your manual outpatient orthopedics type of setting, where perhaps they're working on the musculature, restoring the way that joints move, improving range of motion, decreasing low back pain. Okay? And so in general, these are some of the things for the physical therapist career that I think kind of hit home for me when I saw this presentation. In terms of PTs make a huge difference in terms of quality of life. We spend a great amount of time with our patients. If you've been to the physicians, typically You'll go in, the doc comes in, and how much time would you say that they spend with you?
2 to 3 minutes.
So, okay, 2 to 3 minutes. Probably not more than what? 30, right? 30 is kind of quite a bit. Would you agree? So for PTs, 30 is kind of that standard, I would say. And then depending on the setting, such as the one all the way to the right, that treatment session can go up to an hour, hour and a half, whatever's kind of really needed, of course, within reason. And that being said, the bond that we have with our patients is, in my opinion, to that next level. And I think that's something that I cherish as a PT. It's something that, as I progress my patients and eventually see them go, right, it's often quite a hard thing. Because by that time, we know each other, we know each other's families, and we've heard all these funny stories. And, every week, every session becomes, oh, what happened with that one event? How was that? Right? And so not only are we kind of treating the physical aspects, walking, moving better, but psychologically, I think we also have a huge impact. Okay? Where we've been as a practice, okay, a few years back, this was the vision statement. Okay? By 2012, physical therapy will be provided by PTs who are doctors of PT, recognized by consumers and other healthcare professionals as the practitioners of choice to whom consumers have direct access for the diagnosis of interventions for and prevention of impairments, activity limitations, participation with restrictions, and environmental barriers related to movement, function, and health. So a few years back, the big push was direct access. So hopefully, if you don't know what direct access was or is currently available here in California, where you can go directly to a PT's office and you can be evaluated and treated for a limited amount of time without the need of a physician's referral. In the past, you always needed to get a physician's referral in order to see us or a physical therapist. Now you can go directly to a PT and be evaluated. So that was passed. That's official. And in doing so, our professional body, accrediting or our professional association, they thought that in order for us to be able to be first line healthcare providers, we need to up our educational requirements, if you will. And so before, it used to be a master's in PT, and now you're required to have a doctorate. And the thought is by 2020, all practicing physicians will have a doctorate. As of this year, in the conference, the state conference that we had up in Santa Clara, I believe the city was called. I was up there, I'm not very good with names, but it was Santa Clara, I believe, that's North now. This was a big push. Physical therapists improve the way you move. And so now that we have the direct access, now that more or less the push towards that doctorate is in play, now we're shifting our focus to really identifying and solidifying the movement system so that the public knows that not only is there a cardiopulmonary system or an endocrine system, but there's also a movement system. And that physical therapists, that's what we have to contribute. We are the specialists of that specific system. So that next time, and in the future, when you ask somebody, oh, I got to go see my physical therapist next week, they know, oh, this person is going to have their movement system assessed, evaluated, and treated. Some things that I think you should know in terms of if you are planning to pursue a degree in PT, it is a doctorate, okay? And in order to earn that doctorate, you have to have earned it from an institution that is accredited by what's known as CAPI, okay? And then after completion of the program and graduation of the program, you have to pass a law and a national licensure exam. Okay? Licensure exam is a 5-hour exam, 250 questions. And the law exam is a little bit shorter, 50 questions. For some stats about the program in general, typically programs are anywhere from 2 to 3 years. Western University is a 3-year program. Okay? And then here's the breakdown in terms of how much time you roughly spend in class versus clinical. So of the 3 years, 80% of the time you're within the classroom setting. And when I say classroom, that can entail something like this or in the labs. So where you're actually performing techniques on each other and working on various skills. In terms of clinical education, that's where you leave school for typically about a 3-month period, and you go to work, and you have a person in clinic with you, basically teaching you how to be a live PT. And in that time, you get hands-on experience, you get your own patient caseload, and the nice thing about it is under the guidance of a licensed PT. So should you run into any problems, should you have any challenges, questions, things that you haven't seen before, which there always will be, that person is there to help guide you through, or at least give you ideas and reassurance that what you're doing is optimal. As you guys apply for PT school, I can't stress enough that your studies here are key, especially being on the end that I am now and in the admissions, involved in the admissions process. Your scores, your grades now are terribly important, as I'm sure you already are well aware of. And furthermore, these are more or less the prerequisites for our program. And so that being said, when you come into PT school or graduate school, you're already expected to have already more or less a functional knowledge base. So that on day one in anatomy, we're not necessarily re-explaining kind of what is an origin and what is an insertion. So rather, that terminology is already well in use. You guys should be familiar with those types of things. Once you get out of PT school and graduate, you have the option, okay, to go to either residency first and then potentially a fellowship. What these are just once you graduate, you pass the board, you become a licensed physical therapist, you can go into residency. And residency is basically a post-professional, post-didactic program where you specialize in a specific setting, whether it be pediatrics, orthopedics, neuro, etc. And in that time, again, just like as a student, you'll be receiving one-on-one mentoring. Okay, so should you run into a patient where you just don't know quite what to do, and you're working on things, but they don't seem to be getting better, you have this person here to help you, your mentor, to kind of give you additional ideas, different types of techniques that potentially can progress your patient towards the prior level of function. After the residency, you sit for a special certification exam to get, a special certification exam. And then in order to get to fellowship, typically what you need to have is either that specialty, should have passed that specialty exam, and in the fellowship, that's just further additional training. Again, all these at this point in time are optional. So after your 3 years, the residency program is another year, followed by the fellowship program, which is another year. Okay, so a total of 5 years, if you elect to complete the residency. These are some of the specialty areas in which you can get or earn your specialty certification here. And as you can see, you can be certified in college at home, you can be geriatrics, pediatrics, and I think what should be coming soon is an acute care certified specialist. So that should be interesting. So as I kind of talk about how I got into PT, I want to talk about dreams. Okay, well, specifically my dreams. Okay, this was the dream originally before when I got into undergrad. I wanted to be this guy, the CSI guy. I wanted to be the guy, going to the crime scene and saving the day. And somewhere along the lines, I realized in that case, you're seeing people on their worst day. And there's no really getting better from that, right? More or less, these people have had something terrible happen to them, and more or less, that's the end of the road. And you may or may not figure out what's going on and what happened. Right? I realized that there's a big Hollywood approach to the show, and that might not necessarily be quote unquote real life. All the while trying to pursue a career in essentially law, I was working at a sports bar, a kind of higher end restaurant, and as I started to fade away from my criminology, let's save the day focus, maybe I was thinking, maybe I'll be a restaurant manager. I've heard great things in terms of, wow, they make a lot of money, It's a fun lifestyle. And then it got to the point where, I just don't want to spend all my nights here. One day I want to have a family. One day I want to go home at night. I don't want my 8-hour days to turn into 12, 16-hour days. Okay? And so I spent a lot of time kind of thinking about what I want to do. And it kind of took me all the way back to my childhood and my growing up. And as a young kid, when I was about 10 years old, I was diagnosed with Stickler syndrome. And Stickler syndrome is a connective tissue disorder that, for myself, it affected my eyesight. And so we don't know exactly how this happened. I was young, and but basically, I was playing basketball one day, and it was in a game, and I was going up for a dunk. No, I was going up for a layup, right? And I got undercut, and I landed on my head, and I lost vision in, I can't remember which eye now, right? One of my eyes, and I hid it from my parents for a long time, and I eventually went to the doctor, and of course, annual checkup, and they were wondering why I was looking out of that mask thing like this, right? I was cheating essentially to see the letters. And eventually they found out that I had a detached retina on my right side. And we went through all that process of having it fixed and all that stuff. And then my left one, just for no reason, detached, okay? And so if you are unfamiliar with what I'm talking about, basically I'm completely blind in one of my eyes at different times. And so over a course of, I don't even know how many surgeries, it's quite a few. Eventually I kind of got to rehab, and they were teaching me basically how to kind of walk around. I would be walking around, and because I'd lost my peripheral vision, I'd be bumping into people, and I'd be bumping into things. So rehab really focused on just simple things like being a little bit more aware of my surroundings, turning my head more, that type of thing. And I think that's kind of where the seed was planted. In terms of, it really kind of fueled me to not only pay it back, give back to all the things that helped me become successful and live a normal life, a quote unquote normal life, and also pay it forward. So not only pay it back, but to also, and perhaps most importantly, pay it forward. So here's the new dream, right? If you don't know who that is, he's no longer with the Lakers, but that's Kobe Bryant, and then the longtime trainer, Gary Beatty. And this became my new dream. One of these days, you may see me there. And it might look like something like that. But if anything, what I want to say is that, in all honesty, I have the best set of jobs right now. And the reason why is because part of my week, again, I get to work with so many different types of people, all ages, varying types of pathologies, outpatient setting where they come in and then they go home, inpatient setting where they're stuck in the hospital, right? And whenever I'm out there, I'm here at a campus, a university, working with students, trying to help them achieve the goals that I've been so fortunate to achieve this far. What I leave with you here is asking you these questions, okay? And as you kind of pursue and complete your undergraduate career and start to kind of think about what it is that you want to do, these are some things that might help guide you towards or confirm that PT is the right avenue for you. I think right now, it seems like you guys, I know you guys had to choose what would you be most interested in. But if you have a lot of things in the air that you're interested in, I think that's a great place to be. And that's exactly what I think undergraduate, this is that time for you. Explore, get your hours in, volunteer, find out what it is that you really want to do, because you want to be happy when you're working, if that makes sense. Here's some additional resources if you need. And then I brought some cards for myself, so if ever you have any questions about the admissions process or what a typical day in PT life is, I can do my best to help you out. And if I don't have any answers, I will find you somebody who does. Okay? That being said, if you need, I'll flash back to this at the very end. But my last words: dream big. Right? This is having big dreams for myself has paid off. And thank you. And a little subliminal messaging there. Hashtag choose PT. So again, thank you, Aaron. Thank you, John, for having me come in, and thank you all. Any questions?
Yeah, I have a question. So how was it when you were doing your doctorate? How was it like? Were you like, did you have like a bunch of classes, or did you like have to, or was it like spaced apart?
No. So the doctorate program, it's a pretty rigorous classroom schedule. So typically we'll start them at 8, and they might not get out till 4 or 5. Some semesters they don't get out till 7 p.m. That being said, we don't encourage that you work while in school, just because the course load is just it's pretty rigorous. In terms of semester load, I don't think we have many semesters that dip below 20 units. So they're in class quite a bit. And then in doing so, there's certain skills that you really can't be at home to practice, if that makes sense. So for instance, if we teach you kind of how to assess the range of motion of a shoulder, obviously you need somebody else to be there so that you can assess them. As well as, unless you have like the equipment at home, like a table at home that you can, a treatment table that is at home that you can use, oftentimes they're spending a lot of hours in the labs at night practicing, making sure those skills are ready for assessment and or clinic. Any other questions?
Yeah. What are some like positive and negative aspects of working outpatient versus inpatient care?
Oh, that's a good question. Positive aspects. I would say in terms of, let's do acute care first. In terms of positive aspects, again, I get to spend a lot of time with my patients. Oftentimes we advocate for our patients. So if they feel that they're just not the nurses or the doctors aren't hearing what they need to say, that's part of our job. I would say that it feels terribly good to help a person get up out of bed, and especially when they're not feeling well, or they're afraid to sit up, stand up. Oftentimes that's very rewarding. The downfall, I would say, to acute care is that most of the time they're gone in 7 to 10 days, meaning that they've been discharged to home or a different facility. So that's always fun. You always find people that you really enjoy working with, and then you know that time is limited. With regard to outpatient orthopedics, I think the biggest challenge or the biggest downfall that I've seen is while patients eventually learn to move better, and we do make positive improvements in their lives, full recovery, 100% back to normal, or what the patient considers normal, isn't always achieved, or at least I haven't always achieved it. And to me, that gets me down a little bit. Oftentimes, the patients leave very happy and pleased with how far they've come. But I remember in my initial evaluation what they told me they used to do, and sometimes we fall short of that. So that's always hard. And if I could keep them longer, of course you would, but based on how everything else works, medical benefits, insurance, and all that good stuff, sometimes we're limited in progress. Any other questions? Yeah.
Yeah. I have a few questions.
Sure.
Well, first of all, I want to thank you for being here. It was a great presentation.
Oh, thank you.
I really enjoyed it. I'm interested in orthopedics.
Oh, orthopedics, huh?
Yes. And so what coursework would you recommend me in grad school so I can ease my life in undergrad, so I can ease my life in grad school?
Oh, good question.
I don't really easier like that's but
On our website, you can, and actually not only just Western, but any of the programs that you're interested in, normally they have the bare prerequisite requirements that you'll need. So for instance, I know for us, I believe it's an anatomy, physiology, you need to take a stats course, I believe there's an abnormal site course, and then of course your foundational sciences. So you'll need physics, chem, and bio.
Yeah, besides that.
Oh, besides that,
Yeah.
if you can get into a kinesiology course.
Personal experience with your work as an orthopedic specialist.
Oh, okay. Yeah. So prior to admission, I would definitely say for Western, entry-level kinesiology course is not required, but I would say definitely follow up with or try to get into a kinesiology-based course. A biomechanics course would be good. in terms of other things that will make your life easier, I would say, and kind of make you more appealing throughout the admissions process is get a lot of experience and in a lot of different fields. So I know you guys had a lecture by Dr. Jeff Fairley. He owns his own clinic and he always takes volunteers. And so if you contact him, I'm sure he'd be more than happy to work with you. And then of course, again, don't just kind of pigeonhole yourself into just orthopedics. Make sure that you're well-rounded. Make sure that you spend some time in the hospital. See what that's all about. Honestly, the more the better. Did that answer your question, or?
Yes, yeah. And also for internship, a little bit if I will go in the orthopedic clinic, that would help me.
Oh yeah. So in terms of, are you talking about before getting in, or before? Yes. So the more you can get, again, yeah, the more experience, volunteer experience, or internship experience you can get, the better. I think not only just in terms of how you look as a candidate, but I think for you yourself, is this A, really what you want to do? And B, just to kind of get yourselves comfortable with working with patients and different types of people. Yep.
As far as like an individual like myself, I was going to school initially. I stopped. My major was communications. Since I've been back, my grade trend is completely different, dramatically. And the fact that I changed majors, is that something that, Western takes into account, or is it just basically everything's based on, your total GPA as far as that's concerned?
Really good question. And again, I might be wrong with this, but we have admission counselors that will give you all the kind of rundown. If you go to Western's preview day that Aaron mentioned before, you get all that information. I believe we account for the total GPA for undergrad, and then as well as they look at the last either 60 or 90 units that you take. So say for instance, you're in your last year and you do really, really spectacular. They look at that too, and they take that into account. So it's not just, say for instance, first year, you party too much.
I have like a 10-year break there, so that's, yeah, that's what I mean.
Oh, okay. Yes, absolutely.
Okay.
We look at the whole picture.
And then the last, just one quick, well, might not be quick, but as far as like in my situation, I live on my own, got to pay my own bills, stuff like that. As far as loans are concerned, for going through PT school, are they just pretty easy to get once you get accepted, or is it something, like as far as, because I don't know how you pay your bills and you pay your rent and all that stuff.
Loans.
Yeah. Just, okay.
And in terms of easy to get, undergrad there's FAFSA too, right?
Yes.
Okay, so same process.
So it's pretty much very similar to that. Okay, cool.
And while I said it's not advised that you work, there are some individuals that.
Like if I work 2 days on the weekend or something
Yeah,
like that.
absolutely. Absolutely.
Okay.
Yeah. And then in the business that I know that you
Bartending,
work
stuff like that, yeah.
you can do, a night and you can it just depends. It's very individual specific. Some people, they do well, and I don't know how, but they do well and they barely study. They're just naturally, I guess they're at that level. For me, I gotta study all the time. So, I gotta put in my time, I can work.
Yeah.
On that note, are you aware of any scholarships or fellowships that maybe you or your colleagues have gotten, or your cohort mates have gotten from Western?
In terms of scholarships?
Yeah.
Absolutely. There's a whole plethora. We actually have, I don't believe it's the financial aid department in itself, but there's a specific department that has just a whole listing of scholarships, and you can apply for. And especially, I have to get that. I can look and see if I can get some information for you guys on that. But yeah, there's a whole listing and opportunities are endless.
Can you talk a little bit about admissions in terms of how important is GPA, or what other things that the admission panel looks at?
Sure. With regard to directly in terms of the application review, we have a specific department that looks at those types of things. So how they rank everything, I'm not the person to ask for that. But overall, of course, GPA is a game. There is a bare minimum required GPA that last I checked, I believe is a 3.0 overall. And so I think that's obviously key, that obviously the higher the better. However, that being said, it's important that you all remember that being well-rounded is key. Just like here in your studies, you shouldn't, your professor may not like me for saying this, but you shouldn't just be devoting all your time just to study. You have to spend that time to balance, right? So meaning if you go to the gym for an hour, that's balance, incorporating more things into your life. Volunteering, that's balance. So with regard to the application process, we're looking for that. People who are well-rounded. Not only are they good in the classroom, but they've had a lot of volunteer experience, whether it be PT related or just community related. In terms of the application process, there's an essay component, so we look at your writing abilities, and then if everything's up to par or what we're looking for, then we invite you on campus for an interview so that we get a chance to meet you and kind of give you another chance to show us who you are. And then in doing so, also we want to make sure that not only are we choosing you, but you guys are choosing us. So we want you guys to get to know who we are. We want you to see our institution and show you all the cool things that make Western Western. So for instance, some PT programs don't have a cadaver lab. You guys get, or Western gets their, our students have their own cadaver that they get to work on themselves. And the list goes on.
On that note, if anyone attended the panel that Callie was on earlier this semester, she said she only applied to schools that had that interview component because she knew that if they got to meet her, then she'd have just, that paper that you're turning in. So that's good.
I know Western puts a lot of emphasis on community outreach. Is there anything apart from volunteering that would make you more well-rounded?
You mean?
I don't know. Say apart from volunteering at physical therapy clinics, could you say volunteering with a mental health clinic? Would that be more well-rounded?
Yeah, anything in terms of, just recently they had the Challenge Athletes Foundation. They just ran their big event down in, I believe, La Jolla. Okay. Those were really close with them. A lot of our students compete and volunteer down there in that annual event. Even things such as, have you heard of Toastmasters? That's kind of a public speaking group, something like that. Yeah, there's a whole bunch of things.
On that note, because she mentioned mental health. Can you give some examples how you, as a physical therapist, have interacted with other professions, maybe social work, occupational therapy, speech therapy?
I think at the end of the day, regardless of what specific type of practice you want to go into, I think it's important that we all remember we're all on the same team, and that's the patient's team. So, going back to the question that you had before, what's the benefit of acute care? Another one would be that you are a part of that team. So doctors, physicians are coming directly up to you and say, what do you think about this? What do you think I should order for this patient? And it's really a rewarding experience. Not only work with the physicians, but speech therapists. And lots of times we're communicating in terms of, have you seen a patient in room 300? Not yet. Why? What's going on? And the speech therapist will often tell me, maybe you should back it off to the end, that part of the day, because we just did treatment and there's some complications. And right now, it's probably not a great time. And it's just a fun, dynamic environment. And if anything, that kind of showed me one of the benefits there, as opposed to your outpatient clinic, is that outpatient clinic is more via phone call. And there's just something different in terms of being able to talk directly to, your colleague here, say, collaborate with a comprehensive plan of care for your patients. Yep.
I have a question. So I just found out there's a PT aide. I want to know what's the difference between an aide and an assistant.
Oh, a PT aide versus an assistant, you have to go to a program to become a PT assistant. So there's a 2-year, I don't believe you even, I believe it's an associate's degree, if I'm not mistaken. don't quote me, but I believe it's an associate's degree, and it's a 2-year program, and then you take a national board exam, just as you would for a PT degree. And so that would be your PT assistant. Your PT aide is neither. I believe there are PT aide programs, but you do not need to go to school. Last I checked, you have a PT aide. And if you volunteered at a clinic, we would often refer to you as either a PT aide or a PT technician. Any other questions?
I have one.
Yeah.
Since you work in the actual, like setting, what are some challenges that you have since your per diem that you experience when working?
Specifically under the per diem title?
Well, just in general, like since you're working in the hospital, what are some challenges with patients?
With regard to,
Just working with patients in general.
Oh, okay. Ironically, as when I was a new grad, when I first got out, I was treating. I would call them challenges just because I don't think I had that perspective. And nowadays, now that I treat, I think of it more so, okay, this is how the patient is, and it's a matter of how much can I adapt to accommodate their needs. So I've worked with individuals who, say for instance, have gone in for an elective surgery, and upon waking up from the anesthesia, they're terribly confused. They don't know who they are. They don't know where they are. They don't really know what's happened. To patients who've gone in for just an elective knee replacement, they've come out and they've, in doing or having an operation, they've had a stroke. And so they come out potentially even further impaired as before. Those are always depressing. I think if anything, I look at it as kind of a big database. And the more kind of unique, interesting experiences that I've had, the less shocking, intimidating, frightening it is the next time. And so if anything, I think that's why I've shifted to less of a challenge, more so of a, oh, this is interesting, this is, I'm gonna have to remember this one and store it for future purposes. And the nice thing about, I think, healthcare in general is you have to make sure and always remain humble. You don't know, gotta ask. There's always somebody there who's got a better, another answer, a different perspective. And I think the more we reference each other, the stronger the healthcare system in general is. And the better a clinician you potentially can be for your patients.
Yeah. So I know that once you're in grad school, like talk to a few students, like which would get pretty rigorous and like you'll be stressed out a lot. What are like some things that you could do like once you're in grad school to like?
That's what I was gonna ask.
Yeah, to help you, like, because I know some people would do like intramural sports, so that would be like their way of like kind of de-stressing themselves in a way.
You guys said that you met Callie.
The what?
You guys said that you met Callie, right? Callie Jackson.
Yes.
She's probably one of the best students that I've ever seen balance life. I've never seen, I've seen students who are all about the books, and then I've seen students that are all about having fun, and then I've seen people right in the middle who have a nice balance of both. With regard to things that you can do, oftentimes most students, especially when you get to school or graduate school, you lose sight of that. You want to do well. You don't know each other. You're nervous. You want to focus all about the books and you want to score the best that you can. Completely understandable. But you have to remember it's a marathon. 3 years is a long time. And it goes by quick, but it's a long time. So you don't want to burn yourself out on the front end. So in terms of things that you can do to help alleviate that stress, gym, intramural sports. I know Callie plays on a community basketball team. The class in general, most classes, they often spend time hanging out on the weekends. And so they might come to school and they might play, oh gosh, I can't remember what it's called. It's this little net on the ground though, and it's kind of like volleyball, where you hit the ball. I think it's called spike ball. Have you heard of that? Mm-hmm. Anyways, they come up with all these different crazy games. I'm like, don't you guys have anatomy next week? But anyways, they come up with a whole bunch of games. There's always volunteer opportunities that the program in and of itself is putting on. The institution as a whole, Western, we have various community outreach programs that believe it or not, things like that help bring down that stress. I think the biggest thing is don't forget what you like to do. So a lot of times when our students come in, burn out, I'll ask them, some of my advisees, I'll say, what's going on? What does your daily activity look like? Well, I wake up, I go to school, I go home, and I study. Okay, when's the last time that you did something you liked? So not for weeks. That's oftentimes a challenge that new students have. And if anything, I'll make them. I'll say, okay, your homework is to go to the gym for a half hour. Your homework is to cook dinner for yourself and just sit, no books, just turn it off. And I think once they get that balance, after that first semester, most of the time they're up and running and they forget about me. So while I'm eating, it feels good.
I have one more question.
Yeah.
So how big do like classroom size ranges?
Oh, that's a good question. So it depends per program. I know that SC will accept anywhere, I believe they're up into the 90s. So it's a big class. Western, we're at about 52 to 54. And that's for a lecture. And then for labs, we split. So we'll break it down to about 24, 25, I'd say. And then, which is great, in my opinion, especially for myself. It was nice to have more of a one-on-one relationship with my instructors. And especially when you get to the lab situation where we're showing you things that require quote unquote feel. You need to feel specific limitations in joints and that kind of stuff, and how the tissue feels. It's nice because based on the smaller class size, the increase in terms of teaching assistants that we bring into the lab setting, we can all get to you eventually. So that you guys can feel what we want you to feel. You guys can experience and see the deviations that we want you to see. So we kind of choose what is most appropriate for you. Now you guys are here at a big institution. I would guess this is a smaller lecture hall, or is this pretty standard? Is there like a lecture hall of like 400 or 500 people?
No, it's probably on the bigger side.
Oh, this is a bigger one. Oh, okay.
I think it varies.
Yeah.
Oh,
Yeah, it's definitely not as big as the UCs.
Oh, okay.
Like, some of the UC classes have like 400 people.
Oh,
I
okay.
think that's less common here, but there are some good classes.
This is,
For the GEs and.
okay. Okay.
So you mentioned SC.
Mhm.
What were the other schools that you were looking into, and how did you decide on Western?
I only applied to two. So I applied to Chapman and Western. I didn't hear from Chapman, so I went to Western. But in terms of my application, again, when I was applying, I wasn't streamlined for PT. I really didn't know what I wanted to do. And I thought that was, for a long time, I thought that was a bad thing. I was behind. But as I've gotten older and been through all the experiences that I've been through, I found that for me, that was my course. And that was okay for me. As I started researching schools, I kind of applied toward the back end of the cycle, the specific cycle. So my window too was limited. At the time, I kind of just wanted to get in. I felt like the world was kind of closing in on me. Restaurant business wasn't going to pay out for me. I didn't, crime scene investigator, that wasn't going to become an actor. And so PT was it. And, I too had the same feelings as Callie. My scores weren't the best, but I knew that I was confident enough that if the faculty got to meet me, I at least had a shot. And so I luckily got an interview, and the rest is history. But it turned out to be probably the best choice I've ever made. And again, I thought I'd go to PT school, I'd get out, and I'd save the world as a PT, and I'd never see Western again. And obviously, I love Western so much, I just haven't left. Don't plan to, soon either. I don't plan to either. Any other questions?
As far as I'm projected to graduate here December of 2017.
Okay.
I have one class probably after that for prereqs. When do you think is a good time to really kind of start the process as far as sending in stuff, you know.
What I would encourage you to do is definitely come to a preview day, not only to get information about the program, but you actually meet our chair. And you meet current students, and they'll give you the most real perspective that you can get. I'm more or less a salesman. Western's great. It is. But with regard to the process, I believe our apps are due in, let's say, October. Okay. And so you'll have a window there to complete whatever remaining coursework you have, any kind of additional volunteer stuff. But basically, you're going to apply through what's known as PT CAS, so Physical Therapy Centralized Application Service. It's an online program. I believe it's free to kind of enter your information. But as you actually send out the application, that's where the charges occur. And then I believe that window, every year it opens, I don't know the exact date, but I would presume in around June, July. And then you have that time up until the deadlines to
about 6 months or so.
Yeah. Okay. And then, start thinking of your letters of rec.
Yeah.
Just kind of pacing out everything. You'll need transcripts. You'll have to write a personal statement and all that good stuff. But again, I gave you my part earlier. If you have any questions, I can get you in contact with whoever.
And that's, I got an email from it, it's the 19th, is it? So.
It's on the handout.
Okay.
It is on the 19th.
Perfect.
So I think that's a great segue. If you still had questions after this, go to the preview day. But hopefully you all thought that this was helpful. So if you could all give Grant another round of applause.
Okay, group photo.
Token of appreciation. Even though we have had some interactions with other folks in the PT program, I think it's really helpful to hear it from someone who recently got through and is in the field through. Thank you. Yeah. Can I invite everyone to come up here to take a quick group photo? And then as a reminder, turn in your evals, and the handout has a list of all the different things